All right, so hi guys, I'm Kyle from Early Intervention again. So we are back as another part of our training series that we're doing. So today we have Catherine, who is a licensed professional counselor, and then Scott, who is a speech language pathologist. So they're going to be talking to you guys about biting behaviors in infants. So today we've been able to do this. Early Childhood Options has been able to partner with Early Intervention, and then our Summit Foundation grant to help us continue to do these trainings. Okay, so I'm going to pass it off to these guys, and thanks for coming today.
And it won't just be about infants.
And it won't just be about infants. So, perfect.
Great,
Right.
thanks.
Go for it.
Thanks, Kyle.
Awesome. I'm Scott Pirlo. I'm a speech language pathologist here in Summit County. I have a private practice, and let's see, brief history. I've been doing this for about 25 years.
I'm Catherine Orr, as Kyle mentioned. I'm a licensed professional counselor. I know many of you from some different teacher trainings that I've done around the county. I work for Early Childhood Options as a mental health consultant, and I've done that for about the last 6 years. I do consulting on social emotional development at all the sites around Summit County that have Head Start and early Head Start children. And then, as many of you know, I do some different types of teacher trainings around the county as well. A little bit about me.
Fabulous.
Thanks, Scott.
Sure, no problem. Anyway, like Kyle was saying, today we're going to be talking about childhood biting, some functions behind it, why a child might choose to bite. We're going to be giving you some basic development information, what you would hope to see versus what you might see in one of the children who end up biting, which actually also could be typically developing as well. And then of course we want to make sure that you're leaving with some strategies on how you could deal with a child who bites, as well as dealing with the victim of the biter as well. That being said, any initial questions right off the bat, or are we feeling good about things? Feeling good, good. As Kyle was saying, I'm sorry, we do welcome your questions. We want this to be more of a conversation. We don't want it to be a presentation, so to speak. We're here to address your specific concerns, quite literally, while also giving you the general background that we want to offer up. So if we are going through our information and that triggers a thought, that brings a question to mind, we'd love to hear it, and we'd love to be able to respond to it best that we can, okay? That being said, we're going to just start off with some basic development. When we talk about that, we're talking about kids who are biting, of course, in relation to the basic development. You know, children aren't necessarily going to be getting their first teeth until about 6 months as it is. So we're not overly concerned with our, roughly birth to 10-month range. We tend to not see biting as much, or if we do see it, it might be more gumming on things and not necessarily meant to be an aggressive act. So with the basic development, certainly we want to be able to see things like a child being able to sit up at a few months old. We definitely want to be able to see a child starting to crawl between those months of 8 months and 10 months or so. And certainly getting to the point of walking. And walking, of course, as many of you know, will take place between roughly 11 to 14 months. We have this range of average, and certainly the younger a child is, the broader that range of average is. So when we talk about a child who might be delayed with walking and they're maybe 13, 14 months old, it's really not that big of a delay. If we start talking about things in relation to the fact that they're not walking at 20 months, then we could have some serious concerns. More times than not, when we talk about childhood development, it's almost invariable that a child will learn to walk first before they learn to talk. And when a child is learning to talk, we start getting those first words right around a year, maybe a little bit before for some children, maybe some signs from some children before then, but actual speaking, roughly about 12 months. So as we move forward from there, moving into that 18-month range, we hope that a child is generally having between 10 and 30 words, just depending on the child. And as they move forward in age, to age 24 months, we want them to start being able to have 2 words being put together. And certainly by the time they're 3 years old, at 36 months, we want them to be able to form anywhere between 3, 6 word sentences and phrases. If we're able to do that, then we're having some normal communication take place. However, when we see our children who bite, we see that happening with many different functions, as we were saying. One of those functions might be an inability to communicate effectively. So if a child is having issues with acquiring spoken language and being able to have his or her needs met, we might see a behavior like biting come into play as a way to either gain attention or gain a way to get what a child would want. Beyond that, like I was saying, that average range is so broad, so we want to make certain that if a child is having what we're thinking are abnormal or atypical behaviors, that they're in fact outside of that average range. Make sense to you? Mm-hmm. Sounds good. Did you want to speak a little bit about emotional responses at all?
Yeah. You guys, an outline just went around that you can sort of follow along with our presentation this evening. I'm going to talk now just for a minute or two about typical adult responses to biting. I mean, as Scott said, biting really emerges as as most commonly seen challenging behavior between the ages of about 18 months and 2.5, maybe all the way up to 3. So it's common, and it's actually developmentally normal to see biting behavior in classrooms where you have groups of children together of that age range. But no matter how, many times you might read that and hear that as a parent or a teacher, it really, biting behavior often creates a real visceral, strong emotional response for both parents and teachers. For teachers, it's really upsetting. When you have a child bite another child, it feels different on kind of a different level than other types of aggression. I don't know if many of you can agree with that, but you feel like, you weren't, the children, one child was hurt, and it's your job to keep all the children safe. And first and foremost, it feels really bad that an incident like that happened in your classroom. It's always very difficult to share with both the parent of the child who got bitten and the parent of the child who did the biting. For both of those parents, it's really difficult to hear that an incident like that happened in the classroom. And a lot of times parents especially have a really strong emotional response to hearing about a biting incident. It sort of feels visceral almost. If you were the parent of the child who was the victim of a bite, that mother bear or father bear instinct comes out really strongly for parents, and they can have a strong defensive emotional reaction. They can be angry. For parents of the child who did the biting, parents can sometimes feel a sense of shame, like there's something wrong with their child. What does this mean about their child's future? Are they going to be a bully? Or those kinds of thoughts go through parents' minds and can be really, really upsetting. And I know for all of you that those can be really hard conversations to have, but and maybe some of you have already had to have some of those difficult conversations with parents. The relationship, I can't say it strongly enough, that you build with the parents ahead of time, leading up to any difficult conversation that you have with them, makes such an incredibly strong impact on how that difficult conversation about the biting incident or about really any incident that may be hard to talk to a parent about. It will have such a strong impact on how that conversation goes, and really the outcome of that conversation, how that ends up being, will have a lot to do with how good of a job that you guys have done at establishing rapport and trust with those parents early on, leading into those hard conversations. The worst case scenario that you could face, and sometimes these things are out of your control, but are having to have a conversation with a parent about the fact that their child bit another child in the classroom today, and you've never met them before, you've never seen them, you really don't know them, this is the first time you're really talking with them, that can make that conversation even more difficult, and sometimes can lead to an even more strong emotional reaction on the side of the parents. So just keeping that relationship piece in mind as you do sort of establish that rapport with all parents in your classroom, and at the same time knowing that biting in particular as a challenging behavior can elicit sometimes a really strong emotional response in parents, so just kind of trying to be prepared for that is important. So moving on, it's really important, as with any challenging behavior, just the same with biting, that you begin thinking about biting in terms of what is the function that this behavior is serving for this child. So if you have a child that's bitten more than once and it's become what we call like a persistent challenging behavior that you've seen over time, then we know from research about behavior in general and research on child development that any challenging behavior that persists over time is serving some sort of function for that child. Meaning one way to think about it is that child's getting some kind of payoff for each time they're doing that behavior. So you want to start thinking about what might that function be, because that is going to be the key to how you begin making a plan to how you're going to approach dealing with the biting behavior or the challenging behavior when it happens. So number 2 here, we're going to talk for a few minutes about some of the most common functions of biting behavior in infants and toddlers, and then we'll move on to talking about how to create a plan based on what those different functions are.
Definitely.
Do you want to talk about the first couple,
Sure.
Scott?
So the first one that we would discuss would be a sensory need. When we see biting in young children, one of the first things that I tend to think about in that respect is why. But if it's a young child, I'm kind of going towards teething right away. There's a sensory need in biting for children who are teething. And that basically the act of biting itself, when your child is teething, actually relieves the pain from swollen gums. So there actually is a relief from that pain if a child is actually latching onto something. A lot of times our kiddos explore their world with their mouths. So if they see a cup or a ball on the floor, it's going straight to their mouth. This is also meeting a sensory need. It's not about the fact that they're meeting what's going on inside of their mouth, but they're exploring the object with their mouth at that point. And they could actually be putting their teeth on there, their lips on there, of course their tongue, and certainly trying to just see what this object may or may not be, as they don't or may not know the actual vocabulary item name. So this is how they explore. Beyond just the teething, we have kids who literally have oral sensory issues, and they have a need where they can't necessarily feel their mouth the way that we all might be able to feel our mouth. They might be seeking out input in ways that we, as we move through our own development, had not sought out input. So they seek that out through biting, and that input of just trying to get a crunch or getting your teeth into something is relieving that sensory need. It could come from proprioception, it can come from a vestibular action, but all of that cause results in a bite, and that's due to the sensory need from within that individual's body. However, not everybody has just a sensory need. Sometimes there are behavioral needs, and that can come in many different forms. But first and foremost, more times than not, when we talk about a behavioral need in relation to biting, it's more about attention-seeking behavior. It's a way for a child to reach out and say, hey, listen to me. Even if they don't have words to say, they want to be heard. And this is a way for them to gain attention. So when a child is biting and we give them that strong emotional response, as Catherine was discussing, we might think that we might be consequating what we think is a negative behavior. At the same time, we're also giving attention to that behavior. So even if a child is biting and we see it to be a negative behavior, our negative consequence of a response actually gives attention. And the attention, for some of our kids, could actually end up being reinforcement for them to want to do it again, because they're actually seeking a response from us and they got it. And so if it works, why not do it again? Why not do it again? If we have a kiddo tugging on our leg saying, excuse me, excuse me, excuse me, and we're saying, hold on, because maybe we're engaged in another activity or with another student, and suddenly we get the bite on the leg instead, and we respond to that, we're then, of course, reinforcing the bite, and we didn't validate that our own kiddo, who was using appropriate ways of attempting to intervene or interject, was not validated. So certainly wanting to validate every one of our kids who are trying to do something along those lines, especially if they are known biters. We want to validate what they're going to be attempting to do. So we could at least say to them, give me 1 minute to finish up, and then I can be with you. And we're acknowledging them at that point. That acknowledgement is huge for all of our kiddos. Other ways that that behavioral response can be elicited would be a lack of ability to communicate. I see this a lot in my work. Many of my kids don't speak or speak minimally at best, or might have articulation issues and might have a wonderful repertoire of language to move forward with, but just cannot be understood because they don't have the oral motor planning. So oftentimes, children who have difficulties with communication reach out and bite. It happens. There are ways that we can discuss as far as how to deal with that, and we'll get to that in just a little bit. But definitely something to be aware of for our kiddos who have minimal verbal communication. Also, we know that they might be wanting something. It could be something like a snack. It could be a toy. It could be that little Susie has a toy that Johnny wants, and Johnny doesn't want to use words. He just wants to bite. It's because she's going to drop it, and he can then have it. So again, seeking out and being aware of what our children's choices are. And in doing that, we're really going to be tuning in to our kids. And the more that we tune into our kids, the more that we can meet their needs.
Great. I wanted to just follow up on something that you said, Scott, and that is, remember, we're talking about trying to think about what are the functions of the biting behavior first and foremost as we kind of approach how to deal with it. And looking at it from a behavioral perspective is just super important. And another thing that I wanted to mention is sometimes children will bite in an effort to get attention from their peer. So it may be that adults in their world have had such a strong reaction, and this is kind of what Scott was saying, to the biting behavior in the past, whether it's teachers or parents or other people in their life, that they have learned to bite to get attention that they're looking for from the adults, whether that be the teacher or parent or so on. The key to whether or not that's happening is if you see a child bite and then immediately look at an adult. That's always a key to me, that child has learned. They've learned that an adult is going to come running because they've bitten, and that might be one of the real important puzzle pieces to the picture of figuring out the function of the behavior. But just to make my main point, which is sometimes children are looking for the reaction from their peers. Sometimes they've learned that there's a particular child in the classroom or in the group setting that if they bite or poke or antagonize in some way, that child gives them such a great knee-jerk, very large reaction, and it feels kind of good in a way to toddlers to realize that that gives them a sense of power and control and independence over their world and their environment, to know that they can do something. They're very much cause and effect thinkers. You know, that's why all of our infant and toddler toys are cause and effect. You know, bang the ball and then it falls through the little maze. And sometimes you just might want to think about the biting behaviors. Have they learned that when they bite another child, they get this really big reaction from this child, and they've learned it, and that feels kind of good to them, that they can cause this big event to happen in the classroom. And that's another way, if that is the case, again, then we know that that biting behavior is serving a behavioral function. We're going to talk in just a second about how the key to all of this, of course, is careful observation of children to figure out which one of these functions is kind of your best guess. And we'll talk about that in just a second. I want to talk about one more potential function of biting behavior. And this is something just I've noticed in my work in infant and toddler classrooms, and that's a child's kind of instinctual fight, flight, or freeze response. I think that I've noticed with some toddlers that sometimes, I think it's partly can be due to being overstimulated, too much noise, and being too crowded. If a whole bunch of kids are crowding around a brand new toy that's in the classroom, that is a recipe for and we're talking about toddlers, like 2-year-olds. I'm sure those of you who work in that classroom know that that is a ripe environment for there to be some sort of either biting or pushing or hitting incident. But biting behavior in particular, I think sometimes can come from almost like this lower center of toddlers' brains, where they're almost kind of in panic or fear mode. They've been backed up into a corner, either literally or figuratively, and it is their only, it is their instinctual response to needing space from kids that are crowding them, or to letting the kids and adults around them know that the environment is overwhelming them. And this almost comes from a place of fear. You guys kind of know what I mean? It's like very instinctual. It's not, in that case, it's not serving a behavioral response. They're not looking for attention. They don't care about the attention of the other kids or of the adults. They are biting out of like total fear because they're feeling super overwhelmed. And again, that's going to be more commonly maybe what you want to think of as the function if you see the biting behavior happen when there's lots of noise, when there's when you have the largest size group, like on a particular day. Sometimes I've worked in classrooms where they say, well, Wednesdays are our day where we're completely full and we only have 2 teachers and it feels like a lot of kids to manage, and those are the days when we're possibly seeing this biting behavior happen. Or when, again, some sort of environmental thing has happened in the classroom where kids all crowd to one area of the classroom for one reason or another. And, for one particular child, they may feel like their space is being super infringed upon, and biting may be a reaction to that feeling. So that's another function that you just want to think about and hold in your mind. So we're going to move forward talking about how to approach, once you've kind of zeroed in on what you think the function of the biting behavior is in the child that you're kind of thinking about, then you can better strategize how to approach dealing with the biting. First and foremost, you want to think about how to prevent it, of course, from happening in the first place. And I always tell teachers that I consult with in classrooms, I want your brain energy, all the work we're doing talking right now and all the things you're going to think about after I leave today, I want to be put into how are we going to prevent this behavior. Teachers, and it's just human nature, the teachers and parents, they want to know, what do I do when my child bites? What do I do if this happens again tomorrow? And I'll say, I'll give you some ideas, but what I want you to really think a lot about, if you're going to do any research after I leave or talking with your coworkers, I want you to think about what you're going to do to prevent it from happening in the first place. Because if that's where you put your energy, then you're going to be much more likely to prevent it, of course. And when the behavior begets behavior, so the more biting happens, the more it's likely to happen. Because every time the child bites and gets that rush of whether it's attention or whether it's everybody moves away from them and so they're not as fearful, or they're getting that sensory input they need, every single time it happens, they're learning that that's how they can get that need met. And then they're just more likely to do it again. So you really want to approach it by thinking, how can you prevent it?
And in talking about prevention, we need to figure out that function that we were just discussing again. And using an ABC chart, are you at all familiar with an ABC chart? Some of you may be, some of you may not be. ABC is an acronym for antecedent, what happened before the event. B is the behavior, that's the biting, of course. And C would be the consequence. Was there an emotional response? Did we ignore it? What was it? We also want to be able to track the time, track the day, because we might have a kiddo who bites quite literally, and I've had this 150 times within 1 hour.
Wow.
And somebody else is tracking while I'm defending at times.
Yeah.
Nevertheless, that's a very isolated occurrence for something like that to happen. But also if we have children who are biting and we're able to see that they're doing this 3, 4, 5 times a day, is it happening first thing in the morning? Maybe it's in relation to the fact that they had just separated from a parent. Is it happening right before or right after nap time? Are they tired? Or right before lunch? Are they hungry? Or is it in center's play where there's more free opportunity to just make choices and they didn't know how to communicate effectively, so they chose to bite? In having an ABC chart, we quite literally can track and document the events that take place, and from tracking that and writing copious notes, we could also determine with pretty great accuracy what the function behind that biting was. so that when we do determine what the function is, whether it was sensory, behavioral, or fight, flight, or freeze, or any other combination thereof, we can then know how to move forward with the appropriate form of prevention. In doing so, I could speak to you certainly about sensory aspects and what can be done for prevention if we have determined for a child to have sensory issues in relation to their biting. In doing so, first and foremost, prevention is the way to go, of course. So if we have somebody who has sensory needs, we might want to start doing some oral sensory input activities with them, where you can take your hands and start stroking their cheeks very lightly and give them light massages from their cheeks, from their ears down to the corners of their lips, and just start giving them input. You're hitting their molars, you're hitting their lateral incisors that way, it's certainly getting their gums through the input you're providing, and by doing that, you might be providing that input that otherwise could be acquired through a bite. However, you could take that further, and it depends on how your relationship is with a specific child, because if it's a child and you feel comfortable brushing a child's teeth, that's a great way to give them oral sensory input just by brushing teeth. So I have worked in many preschools where they brush teeth twice a day. Simply, of course, there's great oral hygiene within that, but it also provides oral sensory stimulation so that it minimizes the occurrence and likelihood of a child wanting and having a desire to bite. By doing that at least a couple of times a day for children who are more sensory related kids, typically that type of input can last for an hour or a couple hours. Maybe longer, maybe less. Obviously, as we know, it's all going to depend on the individual child. We might have a child who doesn't respond very well to that stuff at all, in which case you can go a different route altogether. You want to give sensory input? Let's have a snack together. We have crunchy foods. We could give them carrots. We can give them apples. We can give them crackers. And in doing so, they're getting the input of biting simply through the act of having a snack. When they don't, they're getting appropriate attention in that fashion, as opposed to an emotional response or needing to be separated or removed from the rest of the class, which alienates them that much more. We could actually include them. We could include the whole class. So if we know a child has sensory issues, we don't have to just have snack with the one child. Let's have a well-timed snack at 10:30 with carrots or apples. And that way we're giving everybody that input, but we're not isolating one individual. And that way that individual doesn't have to feel called out upon. Does that kind of make sense to y'all?
Can I make a quick comment,
Please.
Scott? Is it true to say that a huge red flag to the fact that the biting behavior may be serving a sensory need is if the child puts lots of things around the classroom in their mouth? If they're not only biting other children, but you see them more than the average kiddo, they're putting every single toy in their mouth. They chew on their clothes a lot. They seek out, they're drooling constantly. They're more orally focused than the other kids in your classroom in terms of you just notice how many other things they put in your mouth. That's always to me like this might be more of a sensory thing than really a behavioral thing.
We've seen the children who talk like this. Am I eating a microphone? Sorry, Brad. Talk like this with their shirt in their mouth, or they might have the long sleeve during the winter and that sleeve from their wrist up to their elbow is just completely soaked. That's more of our sensory kid rather than our behavioral kid. Absolutely. Thanks for that input right there, for sure. Another thing that can be done for some of our children who might not necessarily have age-appropriate cognition. So we're talking about children with developmental disabilities or children with autism. Some of those children who have those communication errors, as we spoke about earlier, might bite, not because they're aggressive, but because they can't communicate how they want to choose to communicate. For those kiddos, where was I going with that? For those kiddos, a lot of what would be appropriate for them would be to give them things like therapeutic and giving them maybe a cold teething ring or something along those lines, so they can actually have something. And you know, other kids are going to see it, and other kids might want what they have, but maybe this is something that's only for Johnny, or it's only something for Susie, and that's just the way it is because we all have our own stuff. And that's
I always
okay.
want to empower teachers because that's a really common statement that teachers make. Well, if we have this special, really cool, flower-shaped cold teething ring for little Susie, all the kids are going to ask for it. And I always say, don't be afraid to make a statement like, this is just Susie's special thing.
Mm-hmm.
Susie needs this, the flower little ring because it helps her be a better friend, and it helps her learn better in our classroom. Mm-hmm. We all have our special things, and this thing is Susie's special thing. And try not to make a really big deal about it, but make one or two simple statements about it, because all the kids in your classroom don't need to have the exact sort of same things.
Exactly.
And they do make, like, school-age kids will wear, like, teething necklaces around their necks.
The
but
chew hammer, perhaps.
the chew hammer, and I've seen that work wonders with kiddos, but I know in toddler classrooms, I don't think you can have one of those because it's a choking hazard.
Of course.
But I have seen that particular tool work wonders for kids, having a teething ring that's in an accessible place to the child, especially during the times of day that they're most likely to bite, and the teacher shows them, this is your special thing. If you feel like you need to chomp on something, this is for you. And during times where they're outside or something, she puts it back in the freezer and then gets it out and makes sure that, little Susie knows where it is when she needs it. Okay, go on.
And even, that's okay. Actually, I mean, many of us as adults grow with quite literally oral fixations. If you guys could see the pen caps at my house, they're completely chewed upon, but that's because I quit smoking 20 years ago, so there's that too. But that was a different oral fixation. Okay, I'm gonna go back on track.
Sorry.
If our children should happen to not respond to these types of sensory activities, and we know that it's a sensory situation and it's not behavioral, and we're kind of throwing our hands up in the air, that's when it is okay, of course, to call in an outside professional. I mean, you guys have access to early intervention through Kyle here, of course. And for the children who are over 3 years old, certainly Leslie knows pretty much every professional under the sun, it seems. But all that being said, it's okay to just say, I don't know what to do. It's okay to say, let's call in somebody else to get a different set of eyes on this. Or have a conversation with the parents, and you may want to check with your primary health care provider, or you may want to check with your therapist if you have a mental health therapist, or occupational or speech therapist, or physical therapist. We have many different spokes that reach out to many other folks who can help in situations. So by all means, we're all interconnected, and we're all here for the betterment of the children that you all are serving. And the way that you can best serve them is, of course, meeting their needs. And if what these strategies that we're talking about today aren't meeting the needs of your children that you're serving, by all means, calling in somebody else is A-OK. Please don't be afraid to do that.
Thanks, Scott, for making
sure.
that point.
Yeah, and then I'll go on to B, which is a communication, also a little bit up my area.
Oh, yeah. You go ahead with that.
You good with that?
Yeah,
Because
because that's
you're
where
going to
we're at.
piggyback on some things anyway.
Yeah, that's fine. That's good. I know.
Great. So when we talk about communication in that respect, then we're talking a little bit more about behaviors. And because when we learn how to talk, quite literally, it is a behavioral thing that we are looking at. We're talking about when a child says his or her first word, what does a primary caregiver do? We give the child feedback. We give them positive reinforcement. Yay! And we do these things, and we want to do these things to encourage more. We want to hear more. So if we're talking about a child who has an inability to communicate effectively and uses biting as an opportunity to try to communicate instead of speaking, what we can then do is provide them with choices. I know you got a lot of things going on, but I'm just going to give you a choice. Do you want to go over by the water table, or do you want to go to the sand table? You could even have pictures that you hold up for them so they could point. And if you have that kind of visual for them, it's going to make it a lot easier if you're pointing across 15 feet of space to the water table or the sand table. Or you could say, do you want an apple, or do you want the banana? The choices could be endless, but the more that we give our children the opportunity to communicate effectively, the less likely we're going to be seeing them reaching out and wanting to bite someone else or ourselves in an effort to gain our attention so they can get their need met, whatever that would be. If we provide them with choices, we might be able to meet that need in an appropriate fashion. Another way that we could do that for, again, some of our maybe more cognitively challenged kiddos is using a picture exchange communication system. And that's literally having a picture at every station and every toy that you have available within your rooms, so that if you're with the child and you can say, what do you want to play with, they might take a picture of the blocks out and put it in your hand, and they can communicate effectively that way, even if they don't have words that can actually say that. If they have the understanding, the receptive language to understand our question, or even, do you want blocks or do you want puzzle? And we're just speaking with minimal, simple language, we're giving them that opportunity. That was more with choices, but with the picture exchange, they have the opportunity to grab a picture everywhere within the classroom, present it to a teacher or another student, and say, let's play, without necessarily using their words. And by doing that, we're again minimizing that opportunity for biting to take place, as we're giving them an appropriate fashion to communicate and have their needs met. You're not gonna piggyback?
Nope, I'm gonna jump right into C and talk
Okay.
about, so if after using your sheet and doing careful observation, you've determined your best guess is that, because we can never determine for sure, right? We're just kind of jumping in with a hypothesis. That's what when we're determining the function of a behavior. And if your best guess is that it's serving a behavioral need, that means that you've noticed that this child is likely seeking attention from their peers or from their adults, and that is the outcome for them that feels good after they've bitten another child or had an incident like that. Remember that some of the keys to that being, to you noticing that that's a function of the behavior, is after a child bites or as they're going to bite, you notice that they look for an adult to be looking at them. They look around for the adult's attention in the room, or that they look immediately after they bite a child, they seem to be very impacted by the child's reaction. It might even almost look like it feels good to them. And that can sometimes feel a little disturbing for teachers, like Johnny almost seemed happy or giggly after he bit Susie and she was biting. It might feel really good to Johnny to get that giant reaction, like I was talking about before, from Susie, and that's one of the keys to you helping to develop that hypothesis about the function of the behavior. I was going to say another key to figuring out that it's behavioral, and that is if you notice, and again, all these things require careful observation, but if you notice that a child looks a little bit bored, or they don't know what to do, like they're wandering around the classroom, I've totally seen this, just kind of like not really interested in anything, or they don't really know where they want to play or what they're supposed to be doing. They might even then zero in on two children who look like they're playing something really fun. These two children are playing with blocks and they're laughing and looking like they're having a really good time. And I have seen children then go right over and bite one of those children. And sometimes to me it's like, I think little Johnny wanted to play with them. We wanted them to look at him and notice him. Hey, I'm a part of this classroom. I might want to do what you're doing, but this is the only way that I know how to get your attention, how to get you to look at me, how to maybe join with you or be a part of your group. Biting is something I've learned is a way that feels like I might be able to do that. But again, that requires you really noticing what little Johnny was doing for the 2-3 minutes leading up to biting Susie. So again, those are all just some little scenarios of what might lead you to think that it's serving a behavioral need. You guys all know this. I mean, I almost like don't even want to say it, but it's so important. It sounds so trivial, but if you know it's serving that behavioral need, then what you want to do is highly focus on giving that child positive attention to the things that they're doing right throughout the day so that they're getting that need met in more positive ways, right? You may even need to teach them some discrete skills, very easy skills that you know that they're capable of learning very quickly. Things like, if you notice that Johnny was seeming like he wanted to play with the two little kids playing blocks, maybe Johnny needs help learning to say words like, I play too? Or can I play? Might be too hard for Johnny. So maybe you can just teach him to say, my turn, or play. And if you can just, you decide that you're really going to focus on teaching Johnny how to say the word play, and then model for him and show him how to use it in an interaction, like when he wants to play with other children or invite them to play, then you can literally feed it to him, have him do it, and praise. And then if you see him doing that or anything even remotely positive like that, in order to socialize with his peers, you give tons of praise and attention to that behavior. That is the key to addressing a behavioral function of really any challenging behavior. And I'll just give you another example. If you think little Johnny is biting to get attention from the teachers, right? So he's looking for a teacher to come swooping in, either right before or as he bites, then you want to really help little Johnny learn how to get attention from teachers in an appropriate way. Like teaching Johnny the word help, or if Johnny is pre-verbal and doesn't have any words, teaching Johnny how to tap to and look at a teacher as a way of getting a teacher's attention, to meet his need. Oh, do you want me to play with you, Johnny? Do you need help with something? You need help, and then you're going to kind of do your best to guess what he might need attention for. But you're going to make a very specific, like discrete effort to teach that child a very specific skill that's easily acquired for them, whether it's just a one word that you're going to teach them and then teach them how to use it appropriately, or a gesture, so that they can learn how to get attention from both their peers and teachers in a positive way. And then you give tons and tons and tons of positive praise when they even come close to getting it right. Even if you have to feed it to them, like do as I say, help, yay, you said it. I mean, some teachers are like, well, I told him to say it. I'm like, so? He's only 2.5. Totally. Given this is what we're trying to teach him to do instead of biting.
It's prevention through attention.
Yes, prevention through attention. Reading books, okay, other things that would be part of your plan if the function of the biting is behavioral is addressing the biting behavior when things are going well, right? So you don't want to only talk to Johnny about biting and how it's bad and it hurts his friends and stuff like that right when a biting incident has happened, but you may read the book Teeth Are Not for Biting, or another social story like No Biting or something like that to your whole group of kids. It was kind of once a week. And then you might even follow up by reading that book an extra time to Johnny at nap time, or letting him pick that book as the book he takes to his cot at nap time, to really help him develop what we call a narrative in his head about the fact that biting is inappropriate and that's not what our teeth are for. Our teeth are for biting apples and eating food and blah, blah, blah. You guys all know the book. That's what it talks about. We need to help. And toddlers, as you guys all know, need to hear reading books many times over and over, and they need to be taught things over and over and over for them to really sink in. So reading books like that, or just talking about our teeth and our mouths and what they're used for and what they're not used for. You could make a fun circle time activity, or like role play, or use puppets to teach your entire group a little lesson. It's kind of around that subject. Again, when little Johnny's in learning mode, he's interested in what you're doing because you have super cool puppets. He's focused, he's paying attention, and it's fun, and that's when his brain is ripe for learning. His brain isn't ripe for learning right after he's bitten another child and you're super mad and he's really confused. It sort of feels good that you came over, but you have this really stern look on your face, and he's really confused. And he may be really upset and frustrated because what he really wanted was a toy or whatever, and now he can't have it. That's not the best time to teach him, right? So you guys all know that. You put that into your plan, that philosophy that we know that children's brains work best when they're having fun and paying attention and things are going well, not when there's been a big incident. And you already talked about choices, offering little Johnny lots of choices to give him a sense of kind of power and control and independence over his world and his environment would be an important piece to the plan as well.
For sure. I'm just curious because you did mention social stories. I just don't know. Are you all familiar what social stories are? Good.
Everybody heard that term?
All right.
If you haven't, you probably read them already and you just don't know that they're called that.
But truthfully, they could be pre-created, and they're stories you could either purchase. The ones that I find to be most effective are ones that I write for the kids that I work with. So I can use those I statements, and I can actually use photos of that specific child and have them keep that book and have them be able to have access to it. And if nothing else, they're able to see the pictures. If they're not remembering the words that we've spoken, the pictures within the book can elicit their own personal responses of what is appropriate, what's less appropriate from that story having been read to them many times over. So if you do have access to the social stories, or if you are needing them and needing to write them, trying to use those I statements best that you can, trying to use those pictures to personalize it for the kiddos. It's going to help make it that much more effective of a tool in trying to minimize the biting as well.
Very powerful tool, social stories. And like Scott said, you can, when a behavior rises to the level that you really want to individualize strategies for individual children, creating their own social story can be a really neat thing to do. And it's really easy if you ever want more help with that. It's something I can easily offer you. Okay, let me just talk for a couple minutes about self-regulation. So remember when that fight, flight, or flight response, like that fear response, we think is our best guess as to what the function of the biting behavior is, that's often happening because the child is overwhelmed. They're overwhelmed, they're overstimulated, and they don't know how to ask for help or get the space that they need. So one approach to again, helping prevent the behavior from happening in the first place. Actually, I don't even have this on here, but just like kind of common sense, try to prevent scenarios where large groups of toddlers are crammed into small spaces. That's usually not a good idea. You guys are all already really good at that. But another thing that can really help prevent that from happening, prevent sensitive children from being overwhelmed by noise, and because sometimes you don't have a lot of control over that. You don't have a lot of control over how noisy things are going to get, and oftentimes you don't have a lot of control over how large your group is going to be. Although I do encourage you, if you have 2 or 3 teachers, to break your parts up of the day into small groups when you can, and smaller groups when you can, and so on. But sometimes those things are just out of your control. There is some research to suggest that every 20 to 30 minutes with toddlers, you should do some sort of self-regulation activity or implement some sort of self-regulation strategy. So what I mean by that is in the middle of free play or right after lunch or whatever, whenever it fits into your schedule to do it every 20 or 30 minutes, especially if you have a group of really sensitive kiddos or a group that is especially loud all the time. You do a little 20-second thing where you ask all the kids to push their hands up to the ceiling and try to pretend that they have to hold the ceiling up. See, they're tensing their muscles when you do that, when you have them do that, and they're naturally going to go all tense, and then you have them bring their arms back down and take a super big deep breath while they do that. You can have them go push on the walls and pretend, if you have a pushing wall, like a wall with a set of hands already drawn out, you can just have the kids imagine that that's all over the walls and that they're going to try to push the walls of the classroom to make the classroom bigger. That's another way to get toddlers in sort of a fun way to tense all their muscles and then relax them. And that actually can be thought of as a self-regulation activity. You can use a breathing ball. A breathing ball is it's also called the something sphere. It's one of these plastic toys that collapses in and of itself, and you can just hook it with your fingers and pull it open, and it can get really big when you pull it open and collapses down when you push in on it. And you can have toddlers do this themselves, or maybe they need a little bit of your help to do this with them, to take a deep breath while they pull the breathing ball open. They breathe in and then they blow out as they push it back in. So it's a way of helping toddlers learn to have control over their breath, that they can actually control their breath if they're looking at a thing like that sphere and breathing along with it. And you're also kind of forcing them to take deep breaths while they're doing that. What else was I going to say? Pushing or banging things as an activity. If you work in a toddler classroom, you're probably doing this all the time, but you may want to do that more if you haven't done it for a while at a particular part of your day, or you're noticing you have a lot of challenging behavior at some kind of chunk of your day. Maybe that's a part of your day where you're not doing much of this self-regulation activity, and you need to put more of that kind of thing in there. So again, physical stuff where they're pushing or banging things together can give some kids that sensory input that they have control over instead of feeling like it's coming from outside of the environment that can kind of actually ground them.
Another way that you could do that is just through marching. Quite literally, that impact of a foot into the floor from coming straight down rather than just regular old walking offers what's known as proprioceptive input. And basically what that is doing is compressing the joints that the child is impacting, and in doing that, it helps regulate their system, quite literally. And if we have children who are regulated, they're going to be that much more ready to learn and that much more willing to participate in an appropriate fashion.
I think we're on our very last little section here. Yeah. Where let's talk for a few minutes about what to do when a bite does occur. And you know, I always hesitate to go right to here's what you should do, because it really is a little bit tailored to exactly how the incident happened. Each incident is sort of case by case and individualized. But generally speaking, I think the experts out there are going to say that if you missed it and you weren't right there and a biting incident happened, you want to immediately respond, of course, by going over and separating the two children and saying to the offender something like, no biting, biting hurts. Something like that. Okay, it could be, I don't know, another, what else have I heard?
Try to minimize language, really.
Yeah.
We don't want to give attention beyond the immediate consequence to the perpetrator, so we can give them our immediate consequence and quite literally shift our attention to who needs it, which is the victim at that point. Even if the victim is a person who may have initiated the whole thing, that's the person who needs the attention at that moment, not the biter. As the biter, we don't want to reinforce that behavior, and we don't want to see that again from our reinforcement.
Yeah, so you guys all know that, right? You want to, even if you're at all unsure about what the function of the behavior is, whether or not it's behavioral or not, you generally speaking want to make a stern statement about no biting and how it's not okay. I read somewhere today you should say biting is not okay and not say no biting, but I don't know. It sort of depends on the age group you have and what you know your children and what might resonate with them more. But you should keep the statement very short and stern and give the bulk of your attention to the victim. It serves a lot of purposes. First of all, the victim is hurt, probably needs ice and needs some tending to, but you are modeling for the perpetrator of the biting that it's the victim who's sad and upset who's going to get the bulk of the adult's attention for this behavior, not, you know.
Truthfully, and it's okay, even making a little bit more of a to-do about it than maybe it might be warranted potentially. But, you know, oh, we got to wash that. Come on.
You may choose to make it a bigger deal, right?
Right, but you know, certainly actually washing it, regardless if the skin is broken or not, is always going to be a very, very universal precaution kind of thing to do, and I would highly encourage everybody to do that. But it is going to give it that more attention to the victim that the perpetrator more than likely will be witnessing along the way, so that the attention is going to the person who warrants the attention, not the one who is seeking, if in fact it is a behavioral.
And then how you attend, either you or your co-teacher. You may have a co-teacher who's able to help and you can kind of divide and conquer, or you may not. You know, every situation is different and every incident is different. But I've seen kind of the full gamut of the reaction in the perpetrator, the child who did the biting. Sometimes those children look totally blank-faced. Sometimes they just look like they don't care at all. They might sort of stare out into space and not have any reaction. Sometimes they may even laugh or look a little like they're enjoying watching what's going on. So it's really weird for teachers and us, but it gives us a clue, right? It's more information as to what the function may be. Sometimes the child who did the biting really starts screaming, crying, and tantruming. They may try to outdo the victim. If you kind of see where I'm going with the crying, they may have said they wanted the toy or something, and now they're like super upset because they can't have the toy, and it leads to a full-on freak-out tantrum for the perpetrator, in which case you often feel like you need to attend to that and sort of deal with that. Anyway, I've seen kind of the full gamut of responses from the perpetrator, which dictates, again, I just sort of point that out. It's not, it doesn't always look the same. Every biting incident does not look the same in terms of a reaction of both the victim and the perpetrator.
I think also something else that we hadn't touched upon, and at least in the outline, is after the fact, when everything is calm and the dust is settled, making sure that we can facilitate appropriate interactions and play with those same two kids so the relationship isn't necessarily completely severed. I mean, if we can repair and we can teach appropriate communication skills for those, specifically the perpetrator, by encouraging to use spoken communication, if that capability is there, and we teach them how to do that, as Catherine was alluding to, then we're literally correcting the biting by teaching the skill that we hope to see. And if we're doing that, we're moving in the right direction. And if the child is responding to it, ultimately, that's what we want, is for that child to be independent and behaving in an appropriate fashion, not seeking out other people's flesh. I like that word, flesh.
But you only want to do that when you know that you have time to be facilitating the play kind of the entire time.
And
so
that's
if you're going to
after.
orchestrate
Thank
it,
you.
because you don't want, you don't want a scenario where there's a child who's been repeatedly bitten who's now super afraid of another child in a classroom. I mean, I have seen that happen.
Yes.
And so because the relationship has been damaged between those two children.
Yes.
And then you end up spending your whole day like making sure they're never near each other because you are so afraid that an incident's going to happen again. It is a good idea actually to help those children learn to play together, but only, you want to do everything possible to prevent an incident from happening again. Only do it when you know you have time to be literally right there within arm's reach of both kids to make sure that you can avoid, an incident happening again, and you can do that teaching. Do we want to open it up?
I think it's time to. I mean, we've covered what we've hoped to cover, but what we don't know is if you guys have specific questions for us. And we know we're pretty much at your time, and I don't want to eat into what Leslie has for you as well, but certainly if you have questions, here we are.
I want to say one last thing. I'm going to pass around a handout about transitions. As many of you already know, it is true of biting, just like it is most challenging behavior, that those incidents typically tend to happen during the transition part of your days. So think about that right off the bat. Again, if you're dealing with this kind of struggle right now in your classroom and you're going to start some tracking, that biting incidents tend to happen around transitions or when children don't know what to do. And that is actually true about all challenging behaviors. Here's some just information about transitions. And here's just a great article. It's very short and sweet. It sort of summarizes everything we talked to you about today in our presentation, called Responding to Your Child's Bite. It's great to pass this out to parents if you have parents that are struggling with a kiddo who's been doing some biting, and good for each of you guys to just read. Reinforces a lot of what we've already talked about, but it's nice. So as those are going around, questions?